Said this is absolutely historic because now we are less than a few hours away when the first jab of the COVID vaccine is administered in India, and we'll be getting you all possible updates from across the country. But let's quickly take you through what the vaccination site and the center will really look like. What happens when you enter a vaccination center? Step one is the waiting room. This is where the recipient's registration and the ID will be verified. Your documents also will be cross-checked. Your Aadhaar will be cross-checked for your credentials. That's the first step. Step two, the very important vaccination room, because the vaccinator will administer the jab in this room. And then you move to the observation room where you will be kept. But before that, in the same vaccination room, you also have a deep freezer to store the vaccines. Now, remember, the vaccines that India has got can be stored at fridge temperatures, so we don't need extremely cold storage facilities. But of course, the temperature needs to be maintained as well. And then, as I said, you move to the observation room where the recipient will wait for a period of 30 minutes to rule out any possible adverse effects. You will be monitored by the medical staff there so that they can see that no adverse effect, no unfortunate incident really happened. So that's really how the vaccination center will look like, and we will have so many of our frontline and healthcare workers who will be going through this entire process today, as India will be taking that historic first jab of the COVID vaccine. My colleagues joining me from different parts of the country. Let me first go across to Pranchu, who is joining us from Lucknow. Pranchu, good morning. Good to have you on the broadcast up in earlier historic day. Just quickly take us through some preparations that have been made, and do we have a clarity of whether only Covishield will be administered here, or will you be having both the vaccines? Pranchu, if you can hear me, I was saying good morning, momentous.
Oh yes, yes, of course. See, I'll show you some very good visuals out here. This is the first lot of vaccines which have arrived here at the Atal Medical University. And see, this is the enthusiasm. The car in which it has been brought in, it has been decked up with balloons, it has been garlanded, and this is how these vaccines have arrived here. These are the boxes in which vaccines are here. Sir, किस तरह की वैक्सीन हुई तो कैसे समाप्त हो सकती है?
वो नहीं, देखिए वैक्सीन है, ये कोविशील्ड वैक्सीन है।
देखिए आपके ये वैक्सीन है, कोविशील्ड वैक्सीन है। इस तरह एक नाम देख सकते हैं। पहली खेप जो है आप देख रहे हैं कि कैसे जो है वैक्सीन की है, और क्या इसमें जो भ्रामक
से कितने सेट्स लाए हैं अभी आप?
जो तमाम
11 वाइल्स लाए हैं।
11 कितनी क्वांटिटी यहाँ?
110 लोग 100 बेनिफिशियरी यहाँ पे हैं।
ओके
जी।
तो क्या ये इसी तरीके से सजा के कार लाए आप लोग?
सजा हम लोग अपने व्यक्तिगत व्यवस्था के साथ सजा करके लाए हैं।
मतलब इंथुजियाज्म में खुशी है कि आज
जी, खुशी, बेहद खुशी है कि ताकि आम जनता को एक लगे कि हम लोग प्रॉपर मेंटेन करके और प्रॉपर साज सज्जा के साथ ला रहे हैं, ताकि आम जनता भी इससे प्रभावित हो।
So see, this is the enthusiasm. These are the healthcare workers who, on their own initiative, decided to garland and decked up, beautified the vehicles in which these vaccines are being brought in. On day one in Lucknow, 1,200 people would be vaccinated at around 12 centers. Now, this is the target. It will be interesting to see out of these 1,200, how many actually, volunteer to come at these centers. Across Uttar Pradesh, it is 31,700 people who have been targeted on day one. So this is a long drawn exercise in the phase one. There are around 9 lakh healthcare workers in Uttar Pradesh who have to be vaccinated. Around 11 lakh vaccines, they have already arrived here in Lucknow at a particular secure spot. And every day, this is how in the morning, the selected vaccines, the required number of vaccines would be moved to different centers. So right now I am at the Atal Bihari Medical University in Lucknow, which is one of the key centers where this vaccination drive will start. The vaccines have arrived here. Doctors and the staff is already coming here, and we are hoping that post 10:30 p.m. once the Prime Minister has interacted with some of the beneficiaries, the actual vaccination process will start.
Right, Pranchu, thanks for getting us that update from Lucknow. Stay on with us. Let me go back to the national capital from where Runjun is also joining us. Runjun, good morning. As we've been taking an update, preparations are on. People have garlanded the cabs and the cars in which the vaccines have come. Just take us through the preparations from the site you're joining us in, and where both the vaccines will be administered, or we'll have only one vaccine as of today.
I'll take your question to the nodal officer here. Right now, I am at Rajiv Gandhi Hospital, which is the Shadra district. In fact, all preparations in place. The nodal officer was just telling me that he was here all night preparing for the big day today, making sure that everything falls in place. Let me also speak to him, Ajit Jain, Dr. Ajit Jain. All set?
Yeah, we are ready. We are ready to receive our beneficiaries. We have done all the dry run by yesterday morning only, and we have repeated it. Now we are...
Less than a year when the COVID-19 outbreak we've seen in the country, we have a vaccine today. How do you feel? I know because you've also seen a lot of deaths, a lot of people suffering. I know you've spent 6 months in this hospital away from your family.
It's a great sense of relief. We were waiting for it. We were very eager to get it, and today is the day when we are really feeling that at last we have got it.
In fact, you've been counselling the doctors, nursing staff and other healthcare workers of this hospital who are getting vaccinated today. So what kind of feelings? Is there anxiety? Is there happiness, or it's a mix of everything?
Like yesterday I have conducted 3-4 counseling sessions, and I have consulted nearly 80-90 beneficiaries. And lot many people, they were having lot many queries. They wanted to know that how long it's going to work, when we are going to get the second dose, and what's the way it works. So we have answered almost every query, and people were satisfied.
And in your stock today, do you have one vaccine or do you have 2 vaccines?
No, we are having one vaccine, that's Covishield of Serum Institute of India, AstraZeneca, Oxford University.
All right. Okay, so that's Dr. Ajit Jain. He's a nodal officer here. In fact, he spent 6 months in this hospital, Rajiv Gandhi Hospital. He says that he's overwhelmed that the vaccine is finally here. In fact, yesterday he counselled about 100 beneficiaries from this particular hospital. And we, in fact, did speak to some beneficiary, and really the emotions are running high here.
Right, Ranjan, of course, and it's understandable. I mean, these medical staff, the healthcare workers, they've been away from their families. They've worked round the clock so that under a year we have a vaccine. I'll continue to go back to my colleagues, but in a conversation with CNN News 18, noted cardiologist Dr. Devi Shetty has expressed confidence over the vaccines and said that he will be, in fact, the first one from his group to get vaccinated.
What has been the learnings like? Are the experience of inoculators different in North and South India? Are there evident urban-rural divide as well?
First of all, before answering your question, let me say one thing. We have been, first of all, I want to thank the government for providing us the vaccine. And we are going to start the vaccination program on Monday morning. And I am going to be the first person in my entire group to take the vaccine myself. I want to set an example for all my colleagues and all my countrymen that I trust science, I trust scientists, and I trust these companies which have made the vaccine, and I trust the system which has validated. And I'm going to be the first person to get the vaccine, and all my colleagues are going to join me.
That's certainly a very, very positive message coming here, Dr. Devi Shetty. Please go ahead and tell me, will this really help that hesitancy that has existed and the doubts and rumors that are being spread, particularly regarding Covaxin? How will you counter that? By leading, by example as you are doing it? Is that the way forward?
I cannot imagine the ignorance of the people. People think that COVID has gone. It has not gone. Who knows, in another 2 months' time or a 1 month's time, we may have a second wave. Second wave has hit every European country. What if the COVID comes back with the vengeance like what it has done in US and Europe? In what way Indians are different than Europeans and others? Okay, when the COVID was hitting Europe, we all said Indian summer will protect us, Indian immunity will protect us. What happened? Nothing happened. We were as vulnerable as all of them.
Experts, they're also giving a word of caution that even after the vaccine, COVID will not be over. So please do ensure that you maintain all possible COVID protocols. Time for us to slip into a very short break. But before we do that, don't forget to follow CNN News 18 on Twitter, YouTube and Facebook. Also remember to follow road signs and traffic laws for road safety. Join Network 18 and Hyundai's initiative towards ensuring road safety in India.